Hello, I'm Susan Flory with The Big Middle. Something completely different this time, a fascinating foray into the science of the future of aging from the first Longevity Leaders Conference in London. My guest's vision of a future morning involves popping pills to slow the process of aging and prevent diabetes, Alzheimer's, cancer, and other diseases. James Peyer trained as a stem cell biologist. Now he's a venture capitalist. He heads up Apollo Ventures, seeding the companies making the breakthroughs to, one day, make those pills. Great to have you on The Big Middle, James.
Susan, thank you so much for having me. This has been a really fun experience so far. It's been a great day and happy to chat.
Well, you've been everywhere on the conference floor with the keynote, panel discussions, and all the rest. It's pretty exhausting, isn't it, the regime? But exciting for you, I would imagine.
I would say, whenever you get so many great people together in one room, the conversations that you have tend to energize a lot more than they exhaust. But, maybe talk to me in another 6 hours or so when I'm about to go to bed. And I don't think I'll have any trouble sleeping tonight.
Absolutely. We conked out for days. Now, you are, without a doubt, a wonderkind in this domain. You were just 29 years old when you set up your fund. That was 3 years ago. When did you first become interested in what let's face it, is the holiest of grails?
I got into this field pretty early. I was around 15 when I decided I wanted to spend my life doing this. And I came in, and I think you'll find that most people who decide to spend their lives researching aging kind of have a trigger point somewhere where they're, hit in the face one way or another with some age-related disease affecting either themselves personally or someone in their family, which happens to many of us, really. But when I was 15, my grandfather got cancer. And so I kind of started coming into the space first by doing as much research as I could to see if I could understand what was happening to him better, and then reaching the conclusion that the way that we treat most cancers by waiting for a disease to happen and then trying to do something about it just wasn't enough. And I didn't want to just wait for a disease to happen to me or my parents or my grandma. I wanted to figure out a way to prevent it from happening. And that led me down the route that ultimately made me become a scientist and work on the prevention of disease.
Your fund, you've invested in quite a few startups. How much money have you invested? Where did the money come from? And I'm also interested in what areas of research you're involved with the potential to extend health spans.
So venture capital funds tend to be pretty private vehicles, and we are no exception there. But what I can tell you is a couple of things, which is that Apollo was created and funded by a really philanthropically minded group of individuals and families that wanted to make a difference in the space by making new medicines. We invest up to $15 million in each company that we go into. We've got 4 investments right now. But I can't disclose many more details than that.
Is it European-based, or is it American, Asian, or is it a global mix?
Great question. Yeah, so I'm obviously American. I live in Germany, though, and I started this with a group of really great German investors. And so we invest all across Europe, in the UK, and in the US.
And what areas of research are you in that most excite you?
There are quite a few. One of the great things about being an investor is that you get to dabble in so many different ideas and kind of put your fingers in lots of different pies. I think we're at a space right now, especially in this aging or longevity biotech field, where lightning is striking in so many different places scientifically, right? Discoveries are being made left and right. And so we're interested in senescent cell biology. We're interested in how our body senses and regulates nutrients. And we're also interested in how our body's cellular recycling mechanisms work, which are all approaches that can slow down the aging process and prevent disease.
Well, one of the companies that you're backing is making newsworthy strides in cell senescence. Explain what that is and what's being done there.
Cellular senescence is a process that is happening in all of us every day. Basically, as our cells divide little by little as we get older, they accumulate damage to their DNA some wear and tear that they accumulate as they go through life. And some of them will slow down and eventually stop dividing and become senescent, which is just a Latin word for old.
They become surplus to purpose. They don't work. They're almost deactivated. Is that it?
Exactly. Except it's even slightly worse. They're deactivated. They're no longer dividing. But instead of undergoing what we call apoptosis, which is a polite suicide, the cells kind of wrap up and recycle all of their nutrients and give it away to other cells to do their metabolic processes. These cells hang around and cause inflammation. And so they actually cause a problem in the tissue. And it was discovered now about 5-6 years ago that if you eliminate those cells by basically letting them continue down the path to apoptosis, you can improve the function of the tissue dramatically. When this was done, the mice had their lifespan extended by up to 35%. And that's healthy lifespan, preventing disease by 35%.
Well, this is the thing. You're at the mouse stage in terms of your research. How long is it going to take something like these processes that you're excited about with cell senescence from the lab into medical clinics?
So there's a fairly well-known company in this space called Unity Biotechnologies that started their first human clinical trials last year. Our company, Clera Biotech, is a little bit behind Unity. We have a different approach where we're targeting kind of a different Achilles heel of senescent cells that was very, very recently discovered, but we'll be in human clinical trials relatively soon as well. We think as early as 2020, although we can't, put an absolute stake down on that, but that's the plan so far.
Well, once you've established proof of concept in the clinic, I suppose you have to get past the government regulators.
Absolutely. So the clinical trials are kind of the first step in this, but regulators so far have been very excited and helpful when talking to us about these sorts of therapies. Yeah, both because they fit within the current sort of treatment regimes, where we are going to be testing things for different indications, but we don't test things for, slowing down aging or something like that. We test these new medicines for real concrete diseases that exist and that all doctors recognize today. Things like muscle wasting or early stage Alzheimer's disease or cancer. Do the clinical trials for that. And then we think after we do those first few proof of concept trials, we could then get to a stage where we say like, hey, this works in multiple different diseases. Maybe lots of people should be on these drugs to prevent disease instead of reacting to them.
There's so many avenues I want to explore with what you just said. But first, let's stick to the science of some of the startups that your fund is backing, James. One of the companies that you're backing has made some strides with the so-called MTOR pathway. What can you tell us about this?
Yeah, this is another really exciting area. MTOR is a protein complex that's at the center of how our body senses and responds to nutrients. And you and many of your listeners are probably familiar with the idea of fasting or intermittent fasting as a way of improving health.
If they're listeners of this podcast, because that's what I do, I do extended fast and intermittent fasting. And I had a couple of shows on with the esteemed sports scientist, Professor Tim Noakes, and he does intermittent fasting as well.
Yeah, one of the reasons that we think that intermittent fasting works to extend lifespan is by slowing down or decreasing the activation of this pathway called mTOR complex 1. And mTOR complex 1, when you deactivate it, turns on a process called autophagy, which is like a cellular recycling mechanism. And that cellular recycling cleans up your cells, for kind of a simplified version of this, cleans up unused proteins and fats around our cells that improve their function. And we think that that's one of the major mechanisms by which fasting extends lifespan.
Are these cells that before they become senescent?
That's right. This is pre-senescent cells. So every cell in the body has some level of mTOR and is able to sense nutrients and respond to it. And so it turns out that a drug called rapamycin that inhibits the mTOR pathway is the most potent pharmaceutical yet discovered for enhancing mouse healthy lifespan. And the company that we backed, which is called Aeonian Pharmaceuticals, has taken this rapamycin compound and figured out a way to modify it so that it's safe for human consumption. Because baseline rapamycin, if you take large enough amounts where we think it could enhance your lifespan, it has very, very nasty side effects. It was originally approved by the FDA as an immunosuppressant, and not many of us want to be immunosuppressed. So we wanted to figure out a way to create a safer version of this. And it turns out that we were able to eliminate one of the off-target effects of rapamycin, which caused it to inhibit mTOR complex 2 in addition to mTOR complex 1, two different groups of proteins with two different signaling pathways. And by doing that, we think we've created a safer drug. But again, to your point about Clara, that's just in the mouse testing stage. We're now in the process of working with regulators, and we have a great team of drug developers taking that discovery through to the clinic to start human testing.
Let's go back to that little mouse. What's the lifespan of a mouse, and what sort of extension did you see?
So we haven't done lifespan extension tests with this molecule yet. So a mouse lives about 2.5 years if it's fairly well cared for. So that means that in order to do a lifespan test with the molecule, you have to wait 2 or 3 years after you've arrived at this new molecule. So we've got our new molecule and we are starting these tests, but we don't want to wait 2 or 3 years to go into the clinic. So what we did instead was test the molecule on a disease that we know is caused by overactive mTOR. It's actually a disease called tuberous sclerosis that affects children and young adults, especially with a specific genetic mutation that causes seizures as well as other complications. And we showed that the seizure rates of these mice went way down when we treated them with this drug. And that's actually what we'll be doing our first clinical test for, is in these patients with a rare disease.
James, I've learned at the Longevity Leaders Conference there are more than 2,000 age-related genes, and some 400 drugs or compounds have been made to manipulate some of these genes. Which discoveries in this area hold the most promise for you?
This 2,000 number is really evidence on how much this field is absolutely exploding scientifically, especially when you think that the first one of these discoveries was made only about 25 years ago in 1993. And so this is all new discoveries since 93. I think that the topics that are most talked about in the aging space right now, some of which we already touched on, senescent cells, mTOR biology. Others are the NAD and sirtuin pathway, which is an important component of metabolism and also seems to enhance DNA repair. So these are actually variants of B vitamins. Nicotinamide riboside is the name of the supplement that enhances NAD, although there are a few variants of this. And by increasing the levels of that, what's called a metabolite, that compound in all of our cells, our DNA seems to repair itself better than without that compound around. And mice, given that compound, live healthier lives. So that's pretty cool. And then another one that's often talked about is the telomere and telomerase pathway.
You read about telomeres all the time. I mean, they've even started to be reported on in the mainstream media, not the academic journals of your realm.
Absolutely. I think that we could actually credit the telomeres and telomerase research with launching the aging space in the mid-90s in some ways. We discovered that as our cells divide, the ends of our chromosomes, which are called the telomeres, these are repeated DNA sequences at the end of each of our chromosomes, they get shorter and shorter with every cell division. And it was hypothesized in the 90s that this was like a clock, right? That as we lose a little bit of DNA on every division, eventually they would get small enough that it would start causing problems and our time would be up. And so when it was then discovered that there was an enzyme that we all had, a protein in each of our cells that was turned off, so switched off in all adults, that when it was turned on, could re-extend those ends of the chromosomes, rebuild our telomeres, we thought it was going to be the fountain of youth. And we weren't quite right. It turns out that, while telomeres do shorten as we get older, they are not the be-all, end-all of aging. Cells tend to age in other ways and be damaged in other ways, usually before their telomeres completely erode. And telomeres are only involved in a few aspects of cellular exhaustion in a living human. Now, obviously, the research here is still developing. It's become a very complicated question. But one of the spots that we know that telomeres are very, very important is in the longevity of our immune systems, because we need our immune systems to constantly be creating new cells, fighting off infections throughout our whole lives. And so the telomeres there, we know, get exhausted. And that's a spot where we're looking at, not just we, but other groups as well, are thinking about applying telomere and telomerase therapies to help enhance the health of our immune systems.
Now, since all of the world's scientists haven't figured out what causes aging, if we can talk about it in those terms, because that seemed to be the theme of the conference, cracking the code to aging and making it a unitary disease is how one of the panel discussions was titled. And you have no clear ways to measure it. So when we get back to those future prevention pills that you'd be making, how would you prove they're working?
This is the key question for the whole field. The reality is that until we have good, what are called biomarkers of aging, so tools where we can determine whether or not something is working, we can't conduct a clinical trial for these preventative therapeutics. I mean, you could, but that would be something like you and I start taking a pill, and maybe I get a placebo and you get the real longevity pill, and then we see if I die first. And that's not a very effective way to conduct a clinical trial. And it would take a very, very, very long time. And so what we would like to do, and there's very good progress here, is figuring out ways to diagnose our disease risk, measuring things in our blood and in our cells, and using those to tell whether a drug is working or not to slow down aging by preventing our risk of disease. And so once there is an agreement between the regulators and the scientists what those measurements could be, and this is, by the way, not a completely unprecedented problem. It happened before, for example, with cholesterol and the relationship between cholesterol and heart attacks. Once there's alignment there, which we think can happen within the next decade, then we can do these really, really fascinating clinical trials.
Your goal isn't immortality. I mean, you're looking at disease prevention. You're not looking at having sci-fi alien immortals rushing around the planet in the next 10, 20, even 50 years.
No, I don't think that that's what we see in the scientific data, nor does that match with what we expect to happen from the drug development and regulatory side. Something very, very exciting is afoot here. But instead of prognosticating about, immortal humans and aliens and these sorts of things, I like to look back instead and think about how 100 years ago, the most common causes of death were tuberculosis, influenza, and pneumonia. And we used to think of those diseases as like, oh my goodness, you have swollen lymph nodes, or oh my goodness, you have a fever. Let's treat your lymph nodes or treat your fever. And then when we realized those were caused by viruses and bacteria, we were able to invent new tools, new medicines targeting those things, vaccines and antibiotics, and eliminate those diseases, and people lived longer and healthier than ever before. And that's when cancer and Alzheimer's and heart disease became the largest human killers. Now I think we're at a similar point. So we've gained an understanding, really just in the last decade, of what the core causes behind these different diseases of aging are. And the new tools we're developing, we think, have the potential to at least prevent, maybe in some cases even reverse these diseases, which means that we'll live longer to the next barrier, right? Which won't be Alzheimer's and heart disease and cancer. It will be something different. For example, supercentenarians, people who live above 110 tend to die of cardiac amyloidosis, which is a very rare condition in the rest of us, but kills almost all people who live to an extreme old age. And so maybe that's the next thing that we're going to have to worry about when we're all living to 100 or beyond.
Or do we even need to worry about it? Isn't aging a feature of our evolution, a natural process? You know, when I was talking to biogerontologist Aubrey de Grey at the conference, he was speaking of curing aging, consigning it to history. But I don't get the feeling that you share that goal.
I guess I'm a moderate from a philosophical perspective in this field, but I don't not share that goal. I think that disease and suffering, human suffering, is something that should be addressed and combated whenever possible. And so when people ask me the question of, how long should people live, I say that that's usually not the sort of question that we should be asking. Instead, we should be saying, do we want to live, if we're healthy, do we want to live until tomorrow? And if the answer is yes, then we should be allowed to do so.
The Silicon Valley tech billionaires trying to cheat death are vilified as narcissists bent on fiddling with the course of nature. Do you frequently find yourself defending the ethics of the work you fund?
Occasionally, yes, but much more, and you can tell from the way that I talk about this field, much more, I think it's important to remember that what we're doing is focusing on preventing disease. And this talk of aging reversal or curing aging or immortality, this is more in the interesting philosophical realm. But what we really can do, if we focus on the data and what's going on in mice, what we have the tools to accomplish is creating a single pill or a series of pills that can reduce our risk and slow down the appearance of Alzheimer's, cancer, and heart disease altogether. And so, to put it very, very directly, if you were to conduct a survey that asked, do you want to take an anti-aging pill? You would get, some people, but not a huge percent of the population saying yes. If you conducted the same survey and said, hey, do you want to take a pill that reduces your chance of getting Alzheimer's disease? Then everybody says yes.
Well, I think it's the anti-aging itself as a term on every single level, especially the beauty industry. It's become a pejorative term. And
I agree.
Maybe in your industry as well, you should back away from defining everything in those terms because it's been much used at the conference.
Absolutely. So when we talk about Apollo, I tend to say that we are a fund focused on the basic biology of aging and making new medicines based on that biology. And the industry that's blossoming out of this, I call the longevity biotech industry, as opposed to the anti-aging biotech or aging biotech industry. Because I think that words are powerful, and using the appropriate terms that describe the data that really exists in the mice is the way of responsibly moving forward.
James, I'd like to hear your definition of old. Is it determined by chronological age or the state of a person's biomarkers?
It's definitely more the latter. I think that old for me is all about when you stop being able to do the things that you want to be able to do and that your body should be able to accomplish. So, I want to be able to run a mile. I want to be able to pick up this heavy thing. I want to be able to remember this or that the way I could in my youth. Those are all symptoms of old.
What are you doing and or taking to slow your own aging?
I subscribe to the very famous words of the actress Mae West, who told us all that we should do everything in moderation, especially moderation. And so when I think about following a longevity regimen, I try not to be too extreme or dogmatic on any particular thing. First of all, I would caveat this by saying every intervention that someone could try won't work perfectly in all people, right? So we talked about fasting a little bit before. Fasting doesn't work great in every single human being. You have to try fasting and see if it works for you. And so I fast. I try not to drink alcohol, although I'll have a beer or a cocktail from time to time. I try to get enough sleep, and I take a multivitamin, omega-3 fatty acids, a longevity drug called metformin, and a very interesting natural compound called spermidine that boosts autophagy. But that's it.
Spermidine. I haven't heard of spermidine, but I have read that a lot of longevity scientists are reaching for the metformin every day. Now, that is something that's normally associated with insulin resistance, pre-diabetes.
That's right. And as we get older, even those of us that have a pretty good diet tend to become more insulin resistant. There was some very, very fascinating work done looking at hundreds of thousands of human patients who were taking metformin into old age. And it showed that the rates of cancer and Alzheimer's disease in those old, and this was diabetic patients taking metformin, went way down, even compared to healthy people, and especially compared to other diabetics, which are at greater risk for Alzheimer's and cancer normally.
And I suppose, and you combine it with the intermittent fasting, which is also good at regulating blood glucose levels.
Exactly. Although this is the part where I do have to say, I have a science degree. I'm a PhD, but that qualifies me as a real fake doctor, not a real doctor.